This morning's second lecture presents me with my second opportunity to introduce Jean Shinoda Bolen to a Chicago audience, and it's really a great pleasure to have her back with us again. As I thought over how I might compose this introduction, I began to summon all the available memories, which are sort of shaky right now, pertaining to Jean, to really constellate my Shinoda Bolen complex. I recollected sitting in my office and hearing Jean's voice for quite a while as Mark Swanson, whose office is next to mine, was editing a tape of her workshop. The memory of this was more one of sound and tone than word and phrase, because he's far away. Jean's voice in the memory conveyed the precise quality in her that impresses me most, her soft-spoken earnestness. The kind of earnestness that is confident but humble, full of gentle humor, and invites you to lean forward and listen closely. You don't want to miss a word because somehow you're soothed by the calm and encouraged to have an experience with depth. The subject can even be painful, yet you endure it because you feel a solid sense of trust. This morning, Jean will take us into the dark place of therapeutic failure, where so much damage can and is done in the name of healing. Each of us in this so-called impossible profession, and each of us who seek a fuller self through psychotherapy, are being offered an opportunity to explore dangerous, forbidden territory this morning. I suggest we let ourselves be held by this voice so we can open ourselves completely to experience the message it carries. Would you please give a warm welcome to Jean Shinoda Bolen.
My subject, The Wounding Shadow of the Wounded Healer, Narcissism and Co-Dependency in the Helping Professions, is a subject that I have been musing upon. This is not a written paper. This is a presentation of thoughts in process. And I begin with the whole metaphor of the wounded healer, which is so Jungian, that even the publication Chiron is named, it could be named, instead of Chiron, it could be named The Wounded Healer, for Chiron was a centaur who was an immortal and then wounded in the knee by a hero, and the wound would never heal. In Jungian work, unlike the psychoanalytic and psychiatric training that I had as a resident at UC San Francisco, the vulnerability and woundedness of the therapist as a therapeutic tool is emphasized. Psychiatry grows out of the medical model, and the medical profession is involved in authority, fixing things, and having proficiency. There is the doctor who knows and does, and the patient who is worked upon by the doctor. The model in Jungian analysis is different than that. When I was a first-year resident in psychiatry, learning about the different schools, I was drawn to the description presented by one of the managers when he was describing in his book on types of psychotherapy what Jungian work was like. And he quoted Jung and used the word chemistry rather than alchemy or alchemical, which I learned of much later. But Meninger's description of the Jungian process was that it was based on the notion of a chemical reaction. That is, for one element, the patient to be helped, healed, treated. The other element in the reaction, the doctor or therapist, would have to be affected also. And all of you who in your professional lives or undergraduate lives took chemistry probably may remember those equations where you have the two compounds and the arrows, and then you have two totally different compounds when the reaction goes forward. So what that model gave to me was an awareness that I have certainly carried to this day. That is, my ability to affect the person in my office must leave me open to be affected by the soul and pain of him or her. That the reaction does in fact go both ways. Another metaphor that I appreciate about the nature of this work and what it's all about is the notion of a descent into the underworld to find both those pieces of ourselves that have been cut off, repressed, those parts of ourselves that were unwelcome in our families, or harmed in our families, or unwelcomed in society. And so in order to be acceptable, we cut ourselves off from those parts. And the model for that is the myth of Procrustes and his bed. That is, if you were a person who would go to Athens, that is, find recognition in the world, you had to pass Procrustes and his bed. And whatever part of you did not fit was cut off. And whatever part of you was not large enough to fill the entire bed, if you were too small for it, you were stretched as on a medieval rack until you fit. And that's a metaphor of how we are processed on the road to a collective center of recognition, approval in the world. Because all of us in this room are men and women who have taken the road to Athens, and as part of that process of growing, had to deny, be ashamed of, cut ourselves off from parts that were not welcomed in the world. And so we often make the metaphor of making a descent into the underworld to find those cut off pieces of ourselves. The underworld is also a place named after Pluto as riches underground. And so in the dark, there are those aspects of ourselves that have not seen the light of day or were put away down there. And part of the process, certainly, of Jungian work is to go into the underworld to retrieve those parts and pieces of ourselves. The metaphor, the myth of Inanna, who, as the one-sided deity, goddess of the upper world, makes a descent into the underworld and at each gate loses a part of her persona, gives up a part of her identity in the upper world, and goes down to meet her dark sister Ereshkigal, is also a metaphor for our work, that each of us has a shadow in the underworld, or many shadow parts, that we may make a descent if we are courageous enough and enter a process to meet who is down there. Now, with the metaphor of the wounded healer goes two possibilities. The first is that the notion is that out of our wounds we become conscious of pain and woundedness. We have compassion as a result, and therefore we can be guides for others into those dark and painful places. And that's true, that our very vulnerabilities, our very imperfections, our very suffering helps us, if we are conscious of what has happened to us and what we feel, helps us to bridge, mirror, and accept and be present for the suffering of what has happened to the people we see. But the problem with being a wounded healer is the potential other when it's not conscious. That is, the two forms that we see so much in our society and in dysfunctional families. That is, identification with the aggressor or identification with the victim. And if, as therapists, we do either of those, then we wound the people who turn to us for help. And we do. In every institute, in every clinic, in every place and house of healing, there are terrible stories of betrayal, of people who have acted out and damaged people further who have come to see us. Certainly in my institute in San Francisco, it has been a painful process to become conscious of such things, to address them, and hopefully to see not that we are different, but the potential to harm is in all of us. The blatant, obvious, terrible stories of therapists who have had sex with patients, even in a sadistic and ritual way, reenacting what was done to that patient as a youngster, is horrible. And it stands out, obviously, as a major, major shadow for any helping profession. But what about the ones that are less obvious, and that there are no acts that define precisely what was done, what boundary was physically crossed over. Then we go into identification with aggressor or identification with victim in many, many different ways. There is, for example, the identification with the aggressor, meaning the parent who had no capacity to see the child clearly and uniquely, who has an idea about what the child should be like, and therefore the child is to be an extension of the image of what the parent holds of the child, or the child is supposed to take care of the needs of the parent. When we have rigid theories about what makes people the way they are, and we project them and insist that this is their reality, we do the same thing. It is a wounding shadow of authority that says, I know what your story is and the meaning of it, and we do not leave it up to the person to discover it along the way. Then there is the sense of fostering dependency. That is often a mother wound that was done to us that we then pass on in fostering dependencies or fears. I mean, parents and therapists have a similar power to help people to grow or to wound them. And that happens in our offices all the time. If we are depressed and feel the world is indeed a bad place, we convey that same fearfulness to our patients and our clients. If we are unable to see their strengths, as their parents were unable to see their strengths, and only see the manifestations of their pain, then we further make them identify with that pain. That's one of these are just some of the problems in the work. Then there are the things that have to do with having our patients meet our needs. And some of them are for self-esteem, to look good, and to mirror back to us as therapists the mirroring that we ourselves wanted and didn't get from our own parents. And so the patient with the positive transference finds herself or himself in the position of providing what is needed to the narcissistically wounded part of the therapist. And I think that Alice Miller's book, The Drama of the Gifted Child, shows how that happens, how closely children dependent on a parent are geared to suppress and deny their own feelings to provide and be what the parent needs for them. And I see those subtle qualities happening in this work. A therapist who has been victimized by a parent's anger and depreciation will, for example, in identifying with that in himself or herself, allow a client or patient to be abusive beyond what is good for either person. I find this in my supervision a common problem for therapists of both sexes, that trained by family to be giving and receptive, not only to the affect that is coming their way. There is a going beyond. It's different for some patients who have repressed anger and do not know that they are angry. That whole bringing it out is healing and helpful. But there are many other people for whom excessive anger was the mode and the defense against feeling in their own families, and they come into offices and they abuse their therapists, and somehow in the name of doing good therapy, therapists find themselves battered and being abused verbally by patients who, in identifying with the shadow and being possessed by the anger, are not helped at all to be so immersed in it. And both parties leave the session feeling the worst for the experience. The therapist because of the, quote, negative transference, unquote, and the patient or client because to be so caught up in expressing that kind of negativity, you feel bad yourself. We have an enormous power to constellate or evoke what is in the psyche of the people we see. A metaphor for the work has been in the positive sense, and then I'd like to just describe it, that it certainly happens negatively. In the positive sense, there is the notion that we at times invoke a Pygmalion effect. That is, we see the beauty and the potential in the soul of the person we work with. And through seeing that potential and loving it, we give it life. And that, I think, is one of the really powerfully and positive things that we do. Michelangelo spoke that what he did was free the figure he saw captive in the stone, in the marble. And you know, that's what we do also. But that's just emphasizing the positive. What happens when the shadow takes it over? And what we see only or mostly is a complex in the person, a negative element that has already taken over that person's psyche, and we focus on it also and only see it. If, for example, we are engaged with a person who has been sadistically treated and now sadistically comes in and abuses us, to not stop that is to not side with an aspect that hasn't grown in that person. So, as part of the shadow qualities of our work, I think there's an important moment with each person that we work with of with every session wondering what is it we are seeing and therefore constellating that is in this person. What are we focusing on and therefore drawing it out? And what are we not seeing and not giving any credibility to? The model that we have in our work is the temenos, or sanctuary. It is actually the same model that holds for the uterine experience in its physiological level and the sanctuary that a family ought to be, but with dysfunctional families so often is not. So looking at a temenos, or the Greek word for sanctuary, here is a place where a person can come and find safety, find sanctuary. There is the boundary of confidentiality, that whatever is said in this room to me, whatever is expressed in fact or feeling or fantasy, is safe with me. I will not go out and tell others, especially in a depreciatory way. But one step more than that is I will listen to what I am hearing without in my own mind demean the person, judge the person, distance myself from that person. That this is a place for where what is brought in can find safety from breaches in confidentiality and breaches in judgment. It's also a place where we accept that we will not exploit our patients. Just as the notion of a child being born into the family is, here is somebody who comes into a family and is not meant to be exploited. That is, to take care of us, even though, in an alchemical way, a child has an enormous effect on the parent and vice versa. Still, there is the sense that the child should be safe from exploitation. The patient, the client, should be safe from exploitation. Sexually is one of it, one of the needs, that the child should be not expected to provide for the parent's sexual needs. But there is in this work the question of financial exploitation, how much unnecessary, prolonged therapy goes on in the name of this is what the client needs, when the therapist is very much aware of the anxiety over his or her own bills and the size of the practice. When do you look out for yourself? When do you look out for your client? And when you are looking out for your own financial needs at the expense of the client, you are living out the shadow of greed and exploitation, and you are doing harm to that person. What about the more subtle effects of expecting the client to live out an aspect of yourself, and you are a voyeur listening to the sexual exploits or the power exploits or whatever it is, that you are getting a high from what you are hearing, your identification with the patient's experience, but the patient or the client goes out and lives it out. It was described in child psychiatry as superego lacunae, when the parent of a delinquent gives a double message, ostensibly holds that this is bad behavior, but secretly the shadow that has been repressed in that parent lives out through the behavior of the child. And I think that also happens in this work. When sexual boundaries have been transgressed in this work, it has almost always focused on male therapists and female patients, and it's focused on what the male therapist did to the female patient. But I find an interesting shadow that goes beyond it, that male therapist often encourages his male patients to transgress boundaries as well, in the name of anima growth or some other justification. It is not examined that the acting out serves to help justify the position that is taken. And this happens all the time. I mean, whatever the shadow issue is, the question of how does it impact when we are unaware of our own shadow on the people we see is all over the place. How much do we betray a patient by identifying with who this person is in the world and getting increased self-esteem because we are seeing somebody important, and how we kind of let it slip to people we know who it is we're treating. Those are transgressions in which the person's need to be in a safe place, in a temenos, is violated to some extent. I mean, there are greater and lesser violations, obviously, but the whole notion of a temenos as being also a place where, like the womb, it is a place where one assumes that growth has its own timing. And now there's some information that it's a chemical in the about to be born baby that sets up a chemical reaction in the mother that initiates labor. Well, this is another place. When do we decide together, the client and us, that it's time to finish the work and to be born out into the world? Is it in response to the growth in the person, or is it something that we impose upon the patient? That's another issue. The issue of abandonment comes up in this work. There are many people who limp out of a therapeutic process because their therapist in some way really abandoned them. And sometimes it is that with hardly any notice at all, there is a termination of therapy at a time that was convenient for the therapist but was dreadfully wounding to the analysand or the client, who is terribly wounded and has reactivated in that psyche what has happened to them before. I think that the knowledge of the spiral journey that the person tells us is their life story instructs us about their vulnerabilities to our actions. The more we know about their story, the more we know that there's a danger in us reenacting their story and wounding them once more. Because the women whose sexual boundaries are transgressed in therapy, I don't know of any woman for whom that has occurred that hadn't had that happen in childhood as well. So listening to our people tells us what their vulnerabilities to reenact the story is with us, and instructs us about what we have to be especially careful about. There are so many greater and lesser aspects of our shadow. I mean, when you go take the metaphor of the temenos, of this sanctuary where you are free not to be exploited, safe from judgment and sadism, where you are free to grow, and we take it into the family situation. There are the dysfunctional family models, which I think enormously helpful for Jungian analysis. that of the narcissistic element in the family and the codependent element in the family, and the whole model of denial. There's a comment that's often made in 12-step circles about how people do not mention the major problem. That is, the elephant in the living room is not commented upon. And I think about patients, clients, who have allowed a great many strange things to happen to them in the therapeutic session. They have had therapists fall asleep on them, arrive drunk, do various improper sexual kinds of acting out, and somehow not reacted by saying there is something really wrong here. Because they are reenacting their own family situation where you cannot afford just to know what is really wrong here, or you'll be out on the street and abandoned. Better to deny what is happening. Better to deny the improper kinds of comments that have been made to patients in therapy and go back again and again. I find the Anita Hill, Clarence Thomas experience that we are right in the midst of as something that happens not only as sexual harassment in offices and careers, not only as sexual problems in the family, but also in consultation rooms where inappropriate comments, inappropriate expressions of wanting a personal relationship, inappropriate sexual reactions to the vulnerable episodes that are being shared happen in the therapist. And when this does occur, how common it is for the client, like the child, to repress it, forgive it, and come back. But there are also other shadows in the work that have to do with what we have cut ourselves off from and therefore do not have accessible in ourselves, and that in turn further wounding the people who come to see us. In a patriarchal culture, men grow into a world where their feelings and their capacity for compassion for others is stifled, if anything, by the experience of competition and being part of the group or the gang or the for male bonding growing up in this culture. Showing vulnerability is often something that just identifies you with the victim. And so out of a need to be accepted, very often what happens is that a man cuts himself off from his feelings, plus he is terribly rewarded for his capacity to be intellectual and to be accomplished in the world. And so the procrustin bed has done its job. And when that happens, as a therapist, when someone comes full of affect, there is a defense against feeling one's own feelings that may kick in here. And what that man, or that well-defended, successful woman in the world who has become the psychiatrist or the analyst or the therapist, by doing the same procrustin number on herself, out of touch with her own feelings, out of touch with her own grief, denying pain, being the good soldier. When someone comes and opens up from the depths of their feeling life, the harm done is the distancing, the intellectualization of the situation, and the general modality that says in subtle ways this is not welcomed. When I was a resident, I read a book by Jerome Frank called Persuasion and Healing. And in the first chapter, I was impressed with what happens to a patient in the first hour of the work. That it's possible to talk about just about anything, when you come into the work with especially an apparently unstructured therapist. And yet every patient learns what we are interested in hearing about. And we do that with a behavior modification subtlety about what we are interested in hearing, what we are bored about hearing, what is welcome in the room, what is not welcome in the room. And consequently, it takes about one session to train our patients about what we are interested in. And this goes on below the level of consciousness and continues to go on in the work. And whatever we are not interested in cannot come out and be valued in the temenos that should be. And that is part of the wounding aspect of the shadow, because we do not allow to come up into our patients often those things that we were not allowed to have ourselves. I remember in my training that I discovered that I had a difficulty with anger from people. That what I did was cut it off at the pass before it even came up. It was like there was a self-defensive, protective, make nice that impaired the work I do. And I look back on a childhood as a Japanese-American child growing up during World War II and realize that the experience I had there was to make nice, to not make waves, to not make people angry at me. And that was an extension of what women in this culture are taught to do all the time. Don't make people angry at you. Well, if you don't make people angry at you, you sail through the world in a little more comfortable way. But if you go into the work of being a therapist or an analyst, you do a great disservice to your people by suppressing it, by cooperating with the denial that the family also had. Because in patriarchies and in patriarchal families, there is the number one person with authority who is entitled to be angry, and no one else is often. In surgery, as a intern, as a medical student, it was perfectly all right for a surgeon to throw his tools on the floor if he got the wrong tool. I mean, this is dysfunctional family in the OR, but it was perfectly acceptable. There is the standing by, and I was recently just on Wednesday, I was talking to the women physicians and reliving with them the experience we had at distancing ourselves from our patients. And it had to do with not being able or willing, in retrospect, to speak up on behalf of our patients, and therefore numbing ourselves to the experience. I recollected that as a medical student at a general hospital, how black and Hispanic women, who were probably 13, 14, 16, young kids, were screaming in pain and labor and fear. And I recall residents who said, "You should have thought of this when you spread your legs." I remember being an intern at Los Angeles County Hospital when Marilyn Monroe had overdosed, and it created a lot of copycat reactions. That is, women whose lives were not terrific, who figured if Marilyn Monroe found no reason to live and committed suicide, that maybe they ought to do the same thing. And so they just came in, just woman after woman, with incomplete suicide, so to speak. And I remember residents speaking with anger at them about, next time, if you're going to do it, let me tell you what it might take to do it. That's the kind of training I had as part of the male initiation. And I think that to some extent that I got a look at what male initiations are like. Don't be a sissy, don't be a bleeding heart, don't have feelings, cut yourself off from them. And then I further find in the nature of the work that we do that we become even further distanced from feelings. And when we do that, it's because we are expected, even especially as a feeling type person, which I am, and I do therapy from a feeling intuitive place, but to put all my feeling intuition to the service of the work and to take as a model that I am not supposed to react myself to what is going on makes me, after a while, out of touch with my own capacity to be expressive about my feelings. And I think that is one of the problems that happens to us in this work. The shadow of identifying with power and therefore fostering dependency is one of the subtle one-up, one-downsmanship problems of being and doing one-to-one work. That a person comes in and does project onto us the transference of authority and parenting and all of that. And that very transference allows us the power to heal, because if we react differently than the authorities and parents in that person's life, then they can change. But if we react the same way, by insisting that we are the authority on what their dreams mean, that we are the authority on what their behavior means, if we foster their dependency upon us and have difficulty allowing them to individuate, then we are wounding them. I think of all of the therapies that I know of, that possibly the Jungian model has more built-in potential to look out for the shadow, as well as emphasizing that we help through our wounded healer model. That is, that individuation is a model rather than there being one model. That makes a big difference. If we can do it, if we can allow our clients and adolescents, like we might or might not be able to allow our children, to be who they want to be, who they are shaped by, as to live out what they are shaped by in their depths, even if it goes against what we would have them do or what would make us comfortable. And you know, there are those moments when our clients, as well as our children, have intentions to be or do something that make us uncomfortable or afraid for them. And that puts us in a moment of truth, of will we trust the individuation process, or will we step in and abort this direction and act with authority? And these are all subtle ways in which the shadow is enacted. The major problem with the shadow is the dysfunctional family, and it's reenacting that. And the themes are many. I see both therapists who identify with authority in an oppressive way, and I see therapists who allow themselves to be codependents to their patients. That is, for every therapist that exploits a patient financially and has them be in the equivalent of unnecessary surgery, unnecessary therapy in order to have an income source, there is the therapist who doesn't collect from the patient, who doesn't assume the patient is capable of meeting his or her responsibilities, and who acts as codependent, who accepts call after call that intrudes upon, and it's usually more likely to be a her than a him, where one is taking far more responsibility for the taking care of the needs of the patient or the client and not looking out for proper boundaries. And without being able to do that for that person, there is a wounding shadow of the wounded healer at work, preventing that person from suffering from frustration and finding that they are capable of actually managing. The question of what we believe for our children and believe for our clients shapes them is so real. I mean, there is such an enormous power that people's psyches have on other people's psyches, especially in transference situations. So that how we see the patient or the client really helps shape who they can become. And if we do not feel them capable of hearing what we have to say, it's often a rationalization for what we are unable to say ourselves. That if we grew up in a dysfunctional family where one did not confront authority and was voiceless, as women tend to be in this culture as in families, it's very difficult to then speak up and risk reenacting one's own wounded childhood. There are those voices in the psyche of the therapist, the wounded healer, that get so in the way often. The words that would say, you are selfish, that you are overly, the ones that insist that you need be overly responsible. That's the other side, the codependent problem of the therapist. So there are both the narcissism that says this person in my office is supposed to be here to take care of my financial needs, my needs for self-esteem, my needs for excitement and hearing about your life, my needs for you to be a good patient, my needs for you to reflect well upon me by, what happens and what you tell your friends and all that stuff, that the requirement that our clients, our patients be mirrors for the wounded parts of ourselves from a narcissistic standpoint, and even provide sexual needs for sexual gratifications, if that is what the need of the therapist is. And the other side, the codependent side, that will accept shadow, not confront it, not help the person inside the psyche who wants to be not identified with a complex, but wants to be free from that to grow, and by being codependent to their abusive side or their overly dependent side, we constellate even more of that particular shadow in themselves. And this is not to say that we can always do it right. Being a therapist, like being a parent, is an enormously rewarding, difficult, and impossible task. Fortunately, there is a great deal of forgiveness in a system where, if compassion is also present, and where, for example, the narcissism is not so great as one cannot admit to errors, insensitivities. What so many of the people we see as ourselves want is an honest, true relationship. A place where we can be intimate without our armor. A place where people, including our therapists, need not be perfect. But if we perceive something to be wrong, or we have a sense that that was a mistake, can we speak up as a patient, as an analyst, and in that container, and have our therapist or analyst validate our perceptions? The issue of denial is so large in the psyche of everybody. Denial of feelings, denial of facts, repression in the name of some kind of don't make waves in the family, don't make waves on the job, don't make waves in society, deny, deny, deny. And it's only when one finds that it truly is a temenos, does the gradual recovery of the feelings come through. And this is certainly being demonstrated and will over time with Anita Hill's revelations about how, yes, she is remembering more facts now than she did before. Well, all of us who are therapists know that. I've worked with people, with women, for 6 years before I got that there was some incestuous memories coming up. Only then was it safe. I mean, we all know that in order to keep the harmony of the family, of the dysfunctional family, we repress. And only when we are in another equivalent of what a family can be for the growing soul, which is the temenos of this work, is it safe enough for what has been buried in the unconscious to come forth. And surely if we have our own awareness of our own fallibilities and wounds, are we comfortable? Are we allowing of that to come up? I think that those folks who do therapy who are most defended against their own history and their own feelings often find it very difficult to allow other people to bring those feelings and affects into the consulting room. It's too dangerous. It's contagious. If it were repressed in the family of the therapist, it could very well be repressed in the therapist's consultation room. It's work that we do that also changes people. I think that what I have done in my musings with you is do something of what I would call circumambulating the shadow. You know, we talk in Jungian circles always about the gold, about the light side, which is quite wonderful about circumambulating the self. But the shadow is as hard for us to grasp as the self. We get glimpses of it. And that is the task of our work, to know what it is that might be of the shadow, and to keep an eye out for it. Now, we are enabled to do that if we have been in a therapeutic, analytic process of our own that hopefully empowered us to retrieve, to recover the wounded aspects of ourselves and be compassionate towards it. We all know as therapists that when we uncover abuse in dysfunctional families, that it's not enough. There is such a lot of work that has to do with the abused person feeling compassionate to the abused child that was abused. And because compassion was not extended to that child when she was or he was in the family, beaten, denigrated verbally, psychologically terrorized, or physically hurt, because the adult who did it was incapable of compassion because he or she was so narcissistic, that person doesn't know how to be compassionate to the victim, to the soul that suffered in the initial wounding. Then there is the work that we have to be compassionate to that part of the person and to mirror that back and somehow provide a space for the healing to take place. And I would say something about psychological healing, which is like physical healing. I'm well aware that in medicine, the surgeon does not heal. The surgeon takes out what was a problem greater than that body could solve itself. And then, having taken out the tumor or whatever, the wound, a clean wound is made and the wound is approximated. But the healing, that which causes the skin to actually close over, that which allows the body to come back to health, the surgeon does not do. The surgeon just provides the possibility of antisepsis and a technique and actually a temenos, to visit a surgical operating amphitheater or room where everyone is gowned, masked, and purified. The whole situation is purified, is to visit a temple where holy work might be done to restore that person. Well, I feel that this is the experience that the soul or the psyche has in our offices as well. That we, if we provide the temenos, if we provide the attitude, if we provide a space where one can be compassionate to the victim, what happens gradually, and we don't do it. There is another force that heals, that comes out of the soul of that person, just as the healing of the body occurs, not because the surgeon does it, but because he or she sets up the situation where healing can take place. So that all of the things that get in the way of contaminating the field, so to speak, that comes from the wounded parts of us, and therefore we wound rather than heal, are the problems in the work we do. The model of individuation that Jung provided gives us at least a model that says, tend to the depths of the person, believe that there is an innate aspect of growth and development along individual lines that is in that soul. There is also the sense of if we are able to be compassionate to our own wounds, we then are able to be compassionate to the wounds of the people we see, and somehow that forms a healing medium for healing to happen. And then there is the part of the work that has to do with listening to our patients' dreams and our own. When in San Francisco we've had analytic transgressions by major analysts, and you know, there isn't a single institute in this country that has not had that problem occur. To listen to the dreams of analyst SANs is to hear that they picked up on the depth level that there was something wrong. I remember one dream of such a person who was not was not being damaged. There wasn't a breaching of the boundaries, and yet she dreamed that she saw her analyst in a dream in which he looked terrible, and he looked like the picture of Dorian Gray. And the analyst said to her, "Oh, it must be a compensatory dream. You have inflated me too much." And she knew that that was not true. And the dream revealed something. The authority of, am I inflating him, am I not inflating him? The decision rested in the dreamer. And the dream was a true statement. Well, for all of us, I think, who do this work, there are times in which the shadow of our shadow may appear in a person's dream. And yes, it is an internal part of that person's psyche. It is a symbol for that person. But the first realm of listening to it is to wonder, is there any applicability? Is it telling me something? And then there is also the listening to our own dreams when our clients or analysts show up in it, and to be open to what our own dreams say. And then there are the synchronicities, the strange occurrences that happen between ourselves and our clients or patients that inform us sometimes that boundaries are being crossed in some way, or whatever it is that it's telling us. So we have an attitude that clearly helps us to track as best we can a shadow that is, by its very nature, hard to see. So we circumambulate it, so to speak. We get glimpses of it. And that is an enormous part of our work. The work we do, we are so much instruments of the work we do. And a major responsibility that we have to the people that we see is to tune the instrument that we are, to know when we are centered. That is, when the ego self-access is in us, in the session, versus when we are in a persona position or when we are in a complex. And I think that it is not too much to ask of us that we pay attention to where we are in this process of the work we do. We also, as Jungians, have inherited a dysfunctional family model that not only comes from Jung, but comes from being embedded in the patriarchy. And consequently, I see that within the Jungian establishment there is both promise and problem. There is the model of alchemy that truly is a healing, wonderful model. And alchemy assumes that love is present, I believe. And that can be an enormously healing kind of a thing. But when we have as a model for the work we do Jung's analysis of the transference and the king and queen, using a medieval alchemist text as the model for transference, and we accept our limitations of consciousness, which I think is a very strong, good thing, that we are not expected to be all-knowing authorities like some other schools of work require that we maintain, and that would identify with the persona. We assume that in the depth of individuation work that we will be unconscious, that the king and queen will be in the bath together, if you recall the pictures from the analysis of the transference. So there are great risks of being unconscious that is part of the healing process. If we maintained in consciousness what the temenos is about maintaining boundaries, seeking outside help if we start to feel like those boundaries are getting confused. Then we are providing and looking out for the temenos, and that is part of what we need to do. But we are also in a tradition of a dysfunctional family. It is now the sins of the fathers down to the third generation in my institute. That the secret of Carl Jung and Tony Wolff and all, when I entered my residency, when I entered the training program in 1966 or 67, it's like the children, the candidates, were not told of it. It was like a secret, a family secret, that there had been this triangle between Carl Jung and Emma Jung and Tony Wolff. And then the secret gradually did get out. So now it's no longer a secret, it's quite in the open. But it is our family history. And then when the next generation gets caught up in unconscious needs and potential for gratification, we see it happen again. And then I might work with a candidate who is being drawn by his needs and his feelings to a woman who is his anima and is his mother and is his alchemical sister and all of that on a symbolic level, and he's getting it all messed up with the actual personal relationship. And he could say, but look, in my family, in my Jungian family, this has been the practice. And the consequences, karmically, if you would, to the therapist who then transgresses the soul of that other person. And I think that when one does that, it is like abducting Persephone into the underworld. There is such a disillusionment. There is such a sense of confusion. I thought you saw me differently. I thought that you would take care of me. Yes, there's a part of that woman who is gratified by the attention and all that. But the confusion and then the shame and the destruction of some self-esteem as other than somebody who takes care of the man is enormous. In sexual harassment at the academic level, the usual result is that the student, that PhD candidate, quits the work when she finds out that the mentor really didn't value her abilities and intelligence, didn't really see her as a potential professional in the field, because by sexually involving his needs with her training, she lost heart and gave up. And this is true in the therapeutic container as well. So there is the repetition of the family story that Jungians really need to address through conscious awareness of what the damage really involves. And this requires compassion. Compassion for the victim is what heals that particular blind spot. The problem for the woman who is seen as only an anima is also a problem. I mean, whether it is sexually acted out or whether the woman finds herself having a very positive projection put on her by her therapist, but then in order to have that wonderful connection and to please the therapist doesn't grow beyond that projection is also a problem. There are a lot of problems in the work we do, and it is like there are a lot of problems in the parenting we do, and yet there is a great deal of gold in the dark places of this work. And I think the gold that we see is something that, I mean, I've mused about why, and that first of all, I'm mused that we really, I think, at heart are spiritual beings on a human path, and that we've come here and are human for some kind of purpose or experience that we could not have by being just a spirit or a soul. And certainly in all of the great religions there is some sense of suffering as being the lot of human life. So there must be something about suffering that we could only experience by being human. And might that have the capacity, that very experience, might we often need to turn to others in order to heal the suffering and make meaning of it. Not heal the suffering. Suffering happens. But meaning and redeeming the suffering is what the journey often seems about. And I think that that is a uniquely human capacity. I remember thinking about an experience with Harry Wilmer when at the 1980 International Congress he presented his work on working with Vietnam War veterans. And he read the paper and he started to talk about his experiences, what he had heard, and he stopped in mid-sentence because he began to cry. And then he said, "Things happen to people that shouldn't happen to anyone." And that's true, and that's what we hear every day in the work we do. When we receive the pain of what was done and what that person did, because everyone who has been in a narcissistic codependent mess has been both the victim and the aggressor so very often. And what occurs when narcissism and codependency occurs in dysfunctional family is a great deal of shame. And that shame makes people feel like they are beyond the pale somehow. And certainly the Vietnam War veteran who was spit upon when he came back to the United States, who did probably participate in experiences that were terrible. Terrible to watch, terrible to do, that which placed him beyond the human community. Well, I see that as the model of what we also do in our office, that those Vietnam War veterans who made it back into community had human beings who were willing to hear the story. And often, as in incest and other awfulnesses that happen to children, there is an obsessive need to tell the story over and over and over and over again until, in the healing environment of a Temenos, something changes and the healing takes place. And when the healing takes place, it is always in a field of compassion, I believe. And the witness is the bridge that brings that wounded part of the person back into communion, back into community, back into connectedness, back to feeling not ashamed and beyond the pale, but somehow part of human life. And we are greatly privileged as therapists to perform that work. And when it happens, we participate in golden moments. That the work of being with another soul who is telling us the truth of his or own feelings, his or own life, places us always, if we are open with our hearts and truly listen without imposing a model on them, without putting a label on what we are hearing, but if we are receptive to the experience of meeting another soul, we go into that timeless kairotic space of time. In Kairos time, we lose track of time passing. We are in a timeless moment, and it is nourishing us and healing us as we are healing the other person. At the deepest level, the alchemy that happens in our office that draws us to this work is that our own wounded sides get repeated experiences in which, if we are open to it, we have moments of pure gold. And we deepen, and we heal, and we participate in what truly are holy moments. So, yes, there is the wounding shadow of the wounded healer, and there is the intent that matters, and the compassion that develops for our own mistakes as well as for what has happened to the people who work with us. Maybe we always keep a wound open. Maybe that's one of the ways in which we do our work. I felt, though, that by going into our own shadow world and recovering our feelings and our history, that we each time get a piece of ourselves back and therefore become more whole, and that's what we offer our people. And that that wondering about what the point of the human journey is, that we are especially privileged to be right at that point of soul meeting soul, finding the gold. And we most need to be so aware, like the surgeon operating on the brain, of that healing occurs not because we do it, but because we create a safe field. And that it's up to us to determine, does this procedure, this work, need to be done for the sake of this soul that is with us or not? And if we tune in to the potential of our shadow, that our psyches inform us, and we learn. Thus, in the process of doing this work, we do find gold in dark places. Thank you.
Questions? Comments?
Thank you very much, Gene. I just was thinking of a masculine spin-off. We know that narcissism can indeed lead a person into incestual behavior within the therapeutic temenos. But our own Jungian story that hasn't been told yet is that there are Jungian ways of men crushing men. That the first 3 psychiatric residents that Jung worked with in Berghölzli committed suicide.
Good grief.
I was leaving Zurich after 11 and a half years, and I said to my therapist, C.A. Meyer, I said, you know, I think I'd like to stay in Zurich, the mountains and so on. Maybe I could stay here. He said, you go home to Chicago. And I said, why? And he said, because I think the pattern that I received, I'm afraid of crushing you like Jung crushed me.
Yeah.
And so the woman's story has been told, but I just would like to add that there is a men's story here as well. And I call it the Kronos complex. And that I think as we begin, I heard someone recently say that what we have to fear in Jungian psychology is Zurich-centrism. Mm-hmm. I think that's denial of a family complex and furthers a codependency. Mm-hmm. The stories of Zurich in 1920 or 30 or 40 need to be heard and listened to. They have to come to voice, not only with women but also with men, in order that we don't repeat them in the year 2020. So, thank you.
Oh, I would fully agree. I would fully agree, and in Gods and Every Man I described that problem of fathers and sons, and not only talk about Kronos but Darth Vader as the problem. And some men have that awareness about when they come. Well, I think that the analysts of both sexes hear about why their people have chosen that particular gender. And women often hear from men that I'm afraid of the competition, that what I have to say will invoke a competitive need in a male analyst to make me subordinate to him, which is what you're saying. And I so agree. This is Tom Lanvin who was speaking, that dysfunctional family, which equals patriarchy, is harmful in its differing ways to men as well as women. And that we in our office risk replicating that same story. And it's not just Jung's story or Jungian family. It is really the patriarchal story.
Gene, you spoke of circumambulating the shadow as well as the way we speak of circumambulating the self. One speaking of it as dark and the other one as light. But I'm certain that you recognize and will speak to this, and that is that there's a certain sense in which a shadow is also in the self, if you will. Particularly, I wonder if you could speak to the idea of the denial of the numinous, the denial of the sacred that often goes on in an analysis. Could you please speak to that?
Well, I think that each of us need to find for ourselves what our sacred moments are. And it's a subjective gnosis. And when we bring it out and expose it to someone else, there's the possibility of that person describing it as pathology. And that is an enormous damage to a soul experience. Is that what you meant?
Yes. Examples that I've experienced where in previous analyses, for example, I'll be very frank, in some Freudian analyses where the sacred aspect of a person's experience, the sacredness of their unconscious experiences with, let's say, a luminous figure of God, is totally rejected in the analytic process, totally treated as delusional.
That happens in a lot of therapy offices where the numinous and the sacred is labeled as pathological, and that also happens in families when children have a major experience of divinity in some way or experience the reality of extrasensory perception and have it defined as pathological and are made to feel ashamed of it for actually thinking they had this kind of powerful experience. And then it is cut off, procrustan bed-like, and put away as a source of shame for being different or inflated, when it really is an enormous source of meaning. And that's part of the soul. That's at the level of damaging the soul that comes into a therapist's office when, in the name of psychotherapy, which is adjustment to the collective outer world, the soul is greatly harmed. And there are a number of therapies and therapists that, of course, do that.
We have time for about 2 more questions.
I don't have 2 questions. I have 3, so you can choose to address briefly all 3 or one of the above. This is from the perspective of a client. I've been in therapy for about 1.5 years. It's been a very wonderful and enlightening experience. At the same time, it has been terribly confusing for me because I don't have any frame of reference for what's going on. And I wondered if you could maybe address some of these issues. And one of this is the wounding that happens, I would say, in the realm of double messages that occur on the part of the therapist. For instance, maybe when an attitude of openness is encouraged, but then shutting down in times of need. I had another example. I can't think of it, but the whole aspect of double messages, or when there is the analytic, detached, objective perspective that is very beneficial, but then on the other hand, imagery given by the therapist that is highly seductive to a vulnerable patient. And I know this is a problem. It does occur, even though there is no physical transgression of boundaries. The second thing is I wonder about the power of the actual word, the importance of that. I'll give an example. When a client is trying to direct a therapist, the choice of the word limitation versus the choice of focus that would convey exactly the same thing in a more neutral or positive sense. The third thing is this whole aspect of synchronicities that you touched upon. I have no frame of reference for this, and I wondered if you have, from your own experience, any idea of what's going on when there have been a whole train of synchronicities that are way beyond probability, if this is a boundary invasion of the client to the therapist's field, or of the therapist to the clients, or there's some kind of meeting that is being unacknowledged. I'm really confused by all these things.
The synchronicities I work with as if they were dreams, so that, and like dreams, when they are evoked, you know that depth material has been constellated in the experience that you're having. So, like dreams, I would work with what they seem to be saying on a symbolic level to try to understand the meaning of them. Other than that is to say that the activated psyche of both people something is going on at that level, and it says something about there therefore being an unconscious place where you're meeting as well as a conscious place. I couldn't agree more about the damage done by double messages. The double message, as many of you know, it was one of the theories about schizophrenia, that for a child to hear with words one thing and to experience the face and the body language and the tone of voice of the parent with the other, that there was a major psychological cognitive dissonance, and that the child had to repress one or the other, and what he usually repressed is the more right-brained experience because it was the more painful. The messages of I love you or you're fine or something, and then the other one is too painful. And it isn't good for people to be in double bind, in double message situations. Now, that's part of being human, though. We all give folks double messages from time to time. The tuning oneself, taking the sense of the work we do as therapists involves that we look out for things, is listening to someone who says, I'm getting double messages from you. And taking that inward, knowing that that can be damaging to the work. What is that about? That's something that a therapist needs to, I think, do some work on in order to be more effective with that person. And there's a possibility always, it's always put out as a first situation, is that you are re-experiencing me the way, you're in a transference situation, I'm really not doing that. And so there's the tuning into both possibilities, but the work of sorting out what one really feels is always the person who has the feelings. Whether it's the client or the therapist, what one really feels shouldn't be ascribed by someone else. One should be able to go into it and feel the feelings. I think that therapy, of course, takes you through a period of confusion. If it didn't, something is wrong. Because you are going through boundaries that have limited you to seeing the world and yourself and your history and your relationships in a certain fairly set way. And now you're breaking down that set way to have access to a wider possibility. And it's confusing. Every time, it's sort of like Peace Corps people coming back to the United States, or, there is to enter the Temenos is to enter a different realm, and the rules are a little different, and the experience is different, and it gets confusing. And it's all right if if it's truly a Temenos. But there's the double message, schizophrenic, crazy-making subtleties that go on between significant others is enormous. I think there's nothing so crazy-making as in any significant couple of which the therapist and client is just one, when one's reality of the situation is not validated.
I think we're going to have to stop there. If other people have questions, I'm sure Gene will talk to you down here. Thank you, Gene.
Say how deeply I'm offended by your use of the word patriarchy.
Patriarchy and men are two different things, and I really have a sense of the attitudes of the culture having a major influence on us all until we see clearly what the attitudes of the culture are. And we are in, historically speaking, a patriarchal period of history, and men and women have been affected by it. And I have written on it. If you would like to get more of my perspective on it, it is in God's in Every Man.
Thank you, Gene. It's a hard place to end, but the conference isn't over.